An accidental discovery by Tasmanian medical researchers could lead to improved treatment for pneumonia and middle ear infections. The Launceston scientists stumbled across a better way to detect strains which are resistant to antibiotics, considered one of the biggest global threats to human health.
Haemophilus influenzae, or bacterial flu, is associated with pneumonia and middle ear infections. It's treated with antibiotics.
So when we have therapy given by your clinician, what they do is they decide to give you a certain drug based on what they think is going to work.
At the moment, it can be hit and miss. Many infections are resistant to antibiotics, a problem that costs Australia's health system $1 billion each year.
When you treat them and the patient doesn't recover, they stay longer in hospital, they're off work for longer.
About 7 years ago, a test was developed to detect the resistance of particular infections. Dr. Tristram and his PhD student found a flaw in that method while studying the resistance of bacterial flu.
It's just literally something we stumbled across. We just one day was using a test and we found that it didn't work as well as it was supposed to. We needed to analyse a lot of data which was already available and put in some extra samples that had a slightly modified mechanism of resistance.
The result was a much more accurate detection method.
And it's surprising that a test that's been used for so long has been so bad, really.
These new tests have been published, and so it allows people worldwide to now adopt the new detection method.
It won't be used on individual patients.
It's used more for research laboratories where they do surveillance over a whole country, over a whole year.
Allowing doctors to prescribe the best medicine. Emily Bryan, ABC News, Launceston.